Okay, this is my capstone presentation, The Educated Citizen, on Omaha and chlamydia rates. So I'm Kayla Gourlette, and this is my presentation over the chlamydia rates in Omaha area. And I chose this topic because I know that chlamydia is a rising infection that can be symptomless in patients, and that can lead to lifelong consequences if it's not treated promptly. Omaha has very high rates of chlamydia, and I also believe that these STDs, not only just chlamydia, but chlamydia is one of the top STDs here in Omaha, and I do think that they need to be talked about more openly. There needs to be more education and treatments so that we can decrease these rates here in the future, right here in Omaha. So I use my educated citizen to help address this issue. My first one is effective communicator. The experience I had my junior year was taking a summer semester. It was a research methods class that was completely online, and I had to virtually find a partner, which was hard. When you're not in class, it's hard to have the confidence to reach out to someone, and we had to take on this semester-long project, so that was very difficult. But what I learned about being an effective communicator is it's extremely important in multiple different aspects, not only just medically, but effective communication with another person to reach an end goal is so important. And this semester really taught me that. We had to we had to Zoom with our professor, we had to be able to email and text back and forth so that we could get this project done. I can use this to address my issue because of the effective communication skills that I learned here in this semester with one other person or another, even more than just one person, to reach the end goal. And that end goal for this issue is to educate and decrease these chlamydia rates in Omaha. So by being an effective communicator, I can help address these issues by learning how to speak with another person more than just face to face and more virtually, which is kind of how our world is coming now. My second experience was this year, my senior clinical, and I was assigned to a patient who had a brainstem stroke and had a lot of other medical complications that had practically put him into a vegetative state. And the family was not from a culture that I was familiar with, and I just really couldn't understand why they were not listening to the medical side of what would be best. And through this, I learned that being an effective communicator in a medical setting is extremely important. Us as medical professionals can teach and educate and talk as much as we want about what we think is right, but even with that effective communication, we need to understand that that may not be what the family believes is correct. So I learned effective communicator skills through this by watching the physicians and nurses and others, social work and therapists talk to the family about this patient. So I can use this to address my issue, knowing that not everyone comes from the same medical background, cultural background, ethnic background even. And as long as we're effectively communicating our education on this topic, some people may not be receptive because it's not what they believe is correct, and there's nothing wrong with that. As far as like STD rates, chlamydia rates in Omaha, this issue that we see affects multiple different cultural ethnic groups, and being an effective communicator by telling the signs and symptoms and the treatments and the consequences of this infection is what we can do effectively to communicate to these patients. My next goal was a reflective individual, and this experience was my sophomore year clinical. I was able to spend a day in the NICU, and the nurse that I was with was assigned to this baby that had an extremely rare genetic disease. I remember them telling us that there was only one other child that had this disease, and the child lived in Germany. So that was very interesting from a medical standpoint. But this one, I was able to learn how to be a reflective individual because the nurse that was taking care of this family, the family was going to be discharged, and the family had requested to have this nurse because of the impact that she had made on them prior to discharge. And being a reflective individual in this situation was just how the nurse was able to reflect on the care that she had given to this family that she didn't even know she had affected and the impact she had. And she just realized that she made such a big impact without even knowing, and it was really touching. So I can address my issue by just being a reflective individual from this situation, and she used her critical thinking skills to help this baby in the NICU and this family, and she was a compassionate nurse for this family on their difficult days that she didn't even realize. And I can relate this to like having a patient that gets a diagnosis of chlamydia, and it can be very scary, and it can be a very life-changing situation for these individuals. And being a reflective individual and understanding where the patient is coming from and just giving them the compassionate care that they deserve and that they need. My second experience as a reflective individual was also my senior year clinical. I was able to take care of a nonverbal stroke patient, and during my clinical, I was able to feed this patient. They couldn't use their hands very well, so I was able to help. And I fed him breakfast, and that did not go well. He did not like how I did it. I was probably rushing him a little bit, and I was getting frustrated, and he was getting frustrated. And then his family came in, and we kind of talked about, he's not eating breakfast. And lunch came, and the family notified me that in their culture, eating a meal is very sacred, and it's the time to take to kind of slow down during this life and be able to enjoy something. And once I went back in with that mentality, the patient ate all of his lunch, which was very, very shocking and touching. And I learned that being a reflective individual in this situation meant to take a step back and think about what that patient needed, what he wanted, not necessarily what I wanted. And he didn't want that meal to be rushed, and so when we were able to sit down and enjoy it, that's what he wanted, and that was what I was able to give him. I can use this to address my issue from this experience, again, with the fast-paced environment. Not everyone is comfortable with that, and someone being diagnosed with chlamydia may need time to just kind of reflect on what happened, and being a reflective individual is someone who understands that. So my experience for change agent in chlamydia was during the COVID-19 pandemic. It happened during the spring semester of 2019, which was my sophomore year, and it made us have the rest of our classes online, which was very abrupt, very, very fast, and we had to learn how to adapt to this new technology and how to learn in this new world. But what I learned from this was to take this change and use this opportunity for growth and development, because it did challenge me and it pushed me very far outside of my comfort zone, which I can use this to understand that being a change agent means that research and education and treatments will always be changing, and to be able to effectively address this issue by being a change agent is to be able to adapt to these changes. And here in Omaha, the chlamydia rates, it's very important to be that change agent and understand that these outcomes are changing, things are changing, and these things take us out of our comfort zone, and to be able to have that conversation with others about being that type of change agent. My second experience of being a change agent was my senior year. I was able to do my service learning project at the Brain Aneurysm Run out in Gretna. We were there to educate and inform the runners of the signs and symptoms and how to get prompt treatment of a brain aneurysm. We also did blood pressure screenings, and I learned that being a change agent through these conversations and this education to these participants in the annual run. Some of the runners had been personally affected. They had family or friends who had suffered, and being that change agent just to educate and help listen and talk to people about what scares them about the signs and symptoms and how to find that quick treatment so that they can live through that. I can use this change agent experience to address my issue because at the run we were decreasing the risk factor. We were trying to decrease the risk factors for a brain aneurysm by education, and this would just directly correlate with the chlamydia in Omaha, with the education, the treatments, and how we can decrease those risk factors if an individual does have that risk of contracting chlamydia. So in conclusion, the educated citizen goals that I learned here while I was at Nebraska Methodist, I will take with me as a new graduate nurse. I have learned so much through these experiences in the public issue that I chose, the chlamydia rates in Omaha. Since it is such a growing issue, I can use these 3 goals to address that issue. Here's my references. Thank you.